Kitware is a software development and consulting company leveraging their strong background in open source platforms to help bring collaborators' software ideas into reality. As experts in computer vision, advanced biomedical image analysis, and data management, among other domains, Kitware's R&D engine can accelerate both commercial and academic projects. Case in point, the Pediatric Airways project was completed in partnership with the University of North Carolina. The goal was to build an atlas of the airway as a child ages. In other words, it was the airway equivalent of a growth chart and could help surgeons determine which airways were normal and abnormal.
I started to get involved in the project when they were writing the proposal, and they were interested in studying the pediatric airway for subglottic stenosis and Pierre-Robin syndrome.
So our goal has been to identify quantitative measures that can be used to help determine whether what kind of intervention, if any, is necessary to help the patient.
Current methods of evaluating treating the pediatric airway problems are subjective or semi-quantifiable at best, and we sought to develop more objective measures.
We have a process of learning how to communicate with folks in different domains, and in this case, we're talking with clinicians. But fortunately, Kitware has a lot of experience working with people in different domains.
The grant was all about bringing these people together to see what could be done in order to further treatment of these patients. But on day one, we realized that we all speak a different language. And so we started off with sort of iterative discussions of the physicians describing the problem and how they work, how they think about it.
In this project, we have a lot of data. So we have something like 200 CT scans. Many of them are from control patients where the airway is normal, at least as determined by Dr. Zadansky. Even so, with those scans, there can be cases where the patient was holding his or her breath when the scan was taken. And what that results in is that the airway is no longer a contiguous space from nostril down to lung, but now it has some kind of almost collapse in the middle. So we had to adapt algorithms to handle that case.
A lot of research that went in the beginning to come up with what algorithms are suitable for this specific data to build these atlases. And then once that's there, how can we create visualizations that are compelling and understandable and easily usable by the physicians?
I think probably they understood more about the aspects of the problem than I did. As I said, I'm a clinician, I take care of patients, do some research that's really more clinically based, and this is all very mathematic, statistics, computer science, computer graphics based, and I think they solve these kind of problems every day, so they really probably knew more about my knowledge gaps than I knew. You don't know what you don't know.
I'm very happy with what we have now in terms of a workflow going from the original CT scan all the way to processed result from geometric measurements such as cross-sectional areas at certain anatomical locations to computational fluid dynamics simulations of the airways that we've segmented.
So in terms of major successes, I think that we, first of all, I think we made some discoveries and broke new ground in how to understanding size of pediatric airway and how that changes. So we were able to see measure that in a way that hadn't been done before and on a scale that hadn't been done before.
I think the staff here is excellent. They were always willing to meet and can turn around things in a very quick time period as needed. They also are people who are well versed in people skills, if you will.
So in terms of impacting a patient, I think that what this does is it helps the physician have more context and more understanding when they're making a treatment decision. So when I'm talking about treatment, I'm talking about surgery of the airway. So it's a traumatic event, and it's something that a lot of times you need to do, but if you can avoid it, you want to avoid it. And so the biggest impact for the patient, I think, is just helping the physician narrow in those middle cases where it's not well understood whether they should do surgery or not. This is one tool to help them understand that.
To find out how we can help you with your commercial or academic R&D projects, please visit kitware.com.